My name is Dr. Amar Puttanna. I'm a diabetes consultant in the United Kingdom, and really today talking to you just about some of the highlights from my day at EASD. Probably the main highlight, and probably the main highlight for the whole of EASD, was the UK-PDS 44-year follow-up data. So as we know, the UK-PDS study was looking at those with type 2 diabetes and intensive glucose control, that 1% HbA1c reduction, and it forms the backbone of what we do in managing people with type 2 diabetes. Well, this is the 44-year follow-up, and what they showed was essentially that treatment effects persisted all the way through these 44 years. So the intensive control group with insulin sulfonylurea showed benefits in microvascular outcomes as well as myocardial infarction, even at 44 years. Additionally, the metformin group showed benefit in myocardial infarction and all-cause mortality at 44 years, therefore sustaining this legacy effect that we've seen from the previous follow-up of the trials. Additionally, they looked at a few other aspects. They looked at cost effectiveness and found that because it is metformin and it's readily available and cheap, the cost effectiveness was again maintained and the quality of life was also improved in patients over this time. They had an interesting thing to look at, an area of my interest actually, older adults and diabetes and dementia. They looked at cognitive impairment and evidence of people having dementia over this 44-year follow-up, and they found that people in the intensive control group had lower incidence of cognitive impairment numerically, but not statistically significant. Now, whilst it's not significant, it does suggest that actually there's more things we can look at in terms of complications of diabetes, and perhaps if there's more data we can consider and perhaps have more robust identifying of patients, we're able to get more information beyond just glycemic lowering alone. That's probably our main highlight. There are a few other sessions, including hypoglycemia management and a call to attention from the International Hypoglycemia Study Group, looking at not just defining hypoglycemia, but also managing hypoglycemia in older adults and trying to avoid unnecessary strict targets to avoid the risk of hypoglycemia and more complications and hospitalization. Also, in the same light, I had a presentation which I was talked about care home management and education of care home workers on diabetes in order to reduce the risk of problems with people with diabetes in care homes, make sure they're managed appropriately, but also ensure that the adequate learning is available. And we managed to show in our study in the UK that there was benefit in terms of a structured education program in in improving knowledge and also potentially reducing risks of hypoglycemia and hospitalization. Those are probably my three main highlights from EASD today. Thank you for joining me.